Dr. CCP to go on with his talk.
Amen. Over to you, Dr. CP.
Hello, good morning, everyone. Okay, let me share my slide. Okay, good morning, everyone. Okay, so now I think it's a prime time for us to talk about the shot, whether is it safe or not. And I think the major concern that everyone is asking right now is it necessary for us to get the booster shot? That's the first question. Second question would be we know that everyone has been receiving the first different primer shot, which is the first two injection. Some of you might have a Pfizer. I myself have Pfizer. Some of you might have AstraZeneca, and some of you might have Sinovac vaccine. So the question arises when the government announced the booster shot, and they're going to give Pfizer to everyone, right? And that question raised a lot of that issue raised a lot of questions. Where should we receive, because there's going to be a mixing of vaccine and whether is it safe. But recently we have a new announcement that they are bringing in AstraZeneca vaccine as well as Sinovac vaccine as booster shot also. So I believe that part sort of resolved lah. But I'm still going to discuss about it because some of us have received booster shot of a mixing vaccine. Just like my mom also received booster shot. So that would be something that we can look into lah, right? So again, as usual, my disclaimer is that any information on COVID-19 is very dynamic. It's always updated on a daily basis. We have new data coming in, and that's why whatever I say today, it might not be valid after 2 weeks or maybe a month, but it's always good to keep reference and know how things has changed. So whenever people say something about old practice, you can actually share with them what is actually new. So I believe in a month's time or maybe in a few weeks' time, there will be more updates about booster shot as well. So let's talk about why do we need a booster shot. The current issue that we facing right now in COVID-19 is that almost everyone in Malaysia, we still have quite a portion of people do not have the vaccine, and also in around the world there are some people who have no access to vaccine. But we have started vaccination for quite some time, and the issue that we are facing is actually the waning of antibodies in our body after the vaccination. And throughout this year, especially throughout the third quarter of this year, we have a lot of report. Okay, there are some is actually peer reviewed, means that the scientists actually rotate the paper, and a third party actually reviewed the paper and says that it is trustworthy, all the data are accurate. But some of the paper here I quoted is actually not yet peer reviewed, means that they are yet to undergo proper review, but the data is out for emergency use. Like this situation in COVID, we have a lot of non-peer reviewed data to actually publish and share what will be the latest practice. So a lot of studies actually quoting that the antibodies start to reduce, okay, after some time in our body. After the vaccination, the antibodies start to drop off, and some of them actually drop to a critical stage where they deem that it is not sufficient to protect us. So this would be the issue that why we need a booster shot. But in terms of vaccination, although right now the way that they determine whether does it work or does it not work, there are two ways. First is through the real world data, where they have inject everyone with the vaccine and they observe, okay, just purely observe and see how many of them get vaccine for those who are unvaccinated versus those who are vaccinated, and those who receive different kind of vaccine. That's the first way that we determine whether the vaccine works or not and how long does it work. And second way of determining is actually using the antibodies, okay, just as a guide to know that how soon the antibodies drop. But there's one issue right now is that previously I believe there are a lot of news actually quoted that says that antibodies drop after certain time of vaccination. But our body immune system is quite a complex system. As you can see, this is a diagram. I believe that some of us who have gone through secondary or tertiary education with a lot of biology, some of us might have actually seen this diagram before. Okay, so what happened is that the body immune system, there are actually two parts. Okay, first would be this part where we have a lot of white blood cell and we have a lot of lymphocyte white cell. So what happened is that whenever we give vaccine, okay, the vaccine is going to trigger this part to produce a defense system, right? This part, this kind of white blood cell, when they receive the vaccine, like mRNA vaccine or maybe adenovirus, inactivated adenovirus, the vaccine is going to train this part of the white blood cell to adapt to it and then have the power to actually go against the COVID-19. But what happened is that when we talk about antibodies, we are only talking about one single type of cell that actually produce the defense system. Okay, but we overlook about the other kind of body immune system. So that's why a lot of people that actually quoted that, oh, antibodies is dropping means that it is not good, but it is only probably partially true. Okay, it's not really the whole picture. There are a lot of other immune system in our body who are also trained against COVID-19, which we can't really measure it. All right, but the only one that we can measure is just the antibody from this B lymphocyte. So it is just a partial of the picture. I mean, I do even actually heard a joke about whether a story of one immunologist doctor as well as a cardiologist doctor got kidnapped by a kidnapper, and then the kidnapper says that I'm going to kill one of you, and you tell me how much you contribute to this world, and I'm going to save the one who contribute more to the world. So what happened is that the cardiologist doctor says, oh, I invented a lot of life-saving drugs, life-saving medications for those with a heart disease and a lot of heart disease. Okay, so I saved a lot of people. Then the cardiologist slowly come and say, well, you know, immune system is a very complex system, and the cardiologist says that, okay, it's fine, never mind, you can kill me. I do not want to know about immune system. It's too complex. He definitely deserve the life for such a complex idea in his life, in his mind. So immune system is a very complex thing. It's not like other disease that we can actually see directly from figures like lab report, but sometimes a lot of things in the immune system we can hardly measure it. So that's why when we come to vaccine, we can't really just refer to the antibodies only, but we have to look into it as a whole, not only to measure the antibodies. So through this report, through the previous report, okay, through this report, what do we know is that, okay, the effectiveness of Pfizer vaccine, AstraZeneca, and Sinovac vaccine, which these three vaccines are available in Malaysia, and also commonly used as a part of our immune vaccination program. All these three vaccines is found to be having a weakened effectiveness in preventing COVID-19 months after second dose. And the average period is around 4 to 6 months. And we can see that different paper, different research paper, different study finding, they code for different duration. Just take an example. Some paper quoted that the Sinovac vaccine will be weakened to a critical point in 4 months, but some paper quoted that it can last up until 6 months. After 6 months, they need a booster shot. All right. But good thing is that although it is weakened in preventing infection, but it still retains the same effectiveness in preventing severe disease, and which means involving hospitalization. After you get the vaccine, after some time, even after 6 months, it still prevents you from getting hospitalization and also preventing from dying from COVID-19. Right? That's the two things that we know about it. And also, they found that the younger individuals, those who are younger than 65 years old, they have a higher level of antibodies compared to those who are above 65 years old. And elderly people, older adults, the speed of decrement, the rate of decrease of the antibodies are faster than those younger. All right. And followed by those with a clinical, high clinical risk group, such as people with a lot of diseases like diabetes, like post-stroke patient or post-heart attack patient. They have a greater risk also of a weaning of the antibodies, right, compared to healthy adults. And otherwise, compared to normal adults like us, these two groups are the group that at risk, because the rate of the antibody decrease is way faster than the normal adults like me and like you all, right? If some of you all are older than 65 or maybe 60 in the developed country, then the decreasing rate will be higher actually. So what does it reflect to the current statistic of this weaning? As we know, Malaysia, we started vaccination since February this year, all right? And right now it's just at the point of after 6 months, around 6 months to 8 months after the vaccination. So what happened in Malaysia setting since the vaccination? We can see that now around October and November, although we have very high COVID cases around July, August, and September, and we are in decreasing trend. But if you have noticed, recently there are a lot of reports saying that the ICU ward occupancy is actually increasing. Okay, they are also observing a trend of a slight increase in COVID-19, and we believe that this is due to the weaning of antibodies. I mean the vaccine effects after 6 months of vaccination program. So here you can see that actually we start to have a little peak here going upward. This is the data from Klang Valley, and this is the data from Malaysia as a whole. There's a little raising here as well. So we hope that this will not be a continuous increasing trend in the future. But hopefully with COVID-19 booster shot, it will actually help us to press down again before it becomes an issue. Okay, that is one of the reasons why Malaysia decided to start with a booster vaccination. So in summary, who should get the booster dose? If you are 60-year-old and above, yes, you should, or maybe if you are 65, depending on different country. Okay, if let's say developed country, then they are using 65, but in a developing country in Malaysia, we are using 60-year-old, right? If you are 60-year-old, then you should get the booster shot, because the vaccine in your body, the immune system in your body is actually decreasing against COVID-19. And if you are younger than 60 with comorbidities, all right, there is also known to have increased rate of the weaning of the antibodies, right? And also those who are young with comorbidities, once they get the COVID-19, they are more likely to suffer from hospitalization and death. And thirdly, would be the frontliner who work in a high-risk environment. So now you can see that people who are 60-year-old and above with comorbidities, they are called for booster shot. So if you actually pay more attention on your MySejahtera, some of you might have actually received the notification. Okay, and those who are frontliner, we also prioritize them in getting the booster shot, because they are constantly exposed to environment with COVID-19. Like the patient, they are sick, they might be bringing in the COVID-19 infection. So then I think the next part will be, people will be interested to know how well the booster shot performed, right? We need to take into some consideration when we discuss this issue. Previously, there are a lot of data quoted for the third dose, okay, third dose of COVID vaccination. But there are some difference between the third dose COVID vaccination and the booster dose. The third dose of COVID vaccination is that right after your second dose, within maybe like 21 days, you will be receiving the third dose to strengthen the immune system. Usually that is for those with a very weak immune system and does not produce sufficient immune response after the vaccination, then they receive the third dose. Or some country, they have their own policy, they decided to go with third dose. But booster dose in this in our terminology is that the third dose of vaccination taken after 6 months completion of a second dose. So when we have this different time frame, we have to be very careful in evaluating any reports that you see on internet. We cannot compare those with the third dose, which is right after 21 days or maybe after a month of a second dose, with what we are currently having, which is 6 months after the second dose, which is called a booster shot, right? And from previous experience, we know that mixing vaccine seems to produce a stronger immune response, and with a downside of more intense side effect. But this previous experience might not be fully applicable to our current situation because our shot is taken after 6 months after the completion of second dose. So it is actually two different kind of story. The time frame is different, right? For the previous one, it's very close to each other, all the shots, and right now we are actually 6 months apart already. So the effect of a first dose and second dose will be way lower whenever we receive the third dose. The response that we expected from the previous research will be not similar, right? Similar, but maybe not until that extent. So this would be the post-booster antibodies level. Okay, for the one of the data we can actually dig out. The issue right now with booster shot is that first is some new practice currently we implement. Secondly, is that different countries, they are utilizing different sets of vaccination. Okay, some countries they only use Pfizer, AstraZeneca, and Moderna. Okay, some countries they don't use Sinovac. Some countries they heavily rely on the Sinovac vaccine. So all the studies they were quoting for different kind of vaccination. So it becomes a bit challenging for me to present and get the data also. So what we are going to do is that we are making use of whatever data we have, and we will postulate the result of whatever we have in Malaysia. So to help us, because in this data they are using the scientific name, so to help us, I actually helped you to actually convert it into the normal terminology we used to, right? The Moderna vaccine, the Pfizer vaccine, and the J&J vaccine. So what happened is that in this particular studies, they have 3 different group of individuals. Those who previously received the J&J vaccine, Johnson & Johnson, those who received the Moderna, and those who received the Pfizer. And they receive a booster shot, okay, be it the Moderna, the J&J, or the Pfizer after 6 months. And this is the result of the antibodies in their body, all right? So what we can see is that during the first day, this is the day one before they get the shot, or right after they get the shot and they take the result, where the immune response is not there yet. And we can see that across the different kind of vaccine, the immune response in terms of antibody level does increase, okay, after 15 days and 29 days of the booster shot, right? Similarly, go to all kind of different vaccine, like the Pfizer, if you receive Moderna, okay, it will increase also. Or Pfizer, you receive Johnson & Johnson, it increase, but to a lesser extent. In fact, Johnson & Johnson right now is actually known to have some issue, as in it have a lower effectiveness and faster waning off, just like our Sinovac vaccine, but even faster than Sinovac. So you can see that the boosting up is a bit slow compared to other vaccine. In fact, you see the J&J level is lower than other vaccine. This is J&J and this is other vaccine. All right. So right now we are using Pfizer. So we probably will look into a Pfizer vaccine. Okay. So Pfizer person, this is the Pfizer level. Okay, at day 1. And what happened after 15 days of a Pfizer booster shot? It does show increase in terms of your antibody levels. In fact, it is all the same. Okay, almost similar level. Okay, at the same level, almost similar level after 29 days. Okay, after the booster shot. So it means that the booster shot, in a way, it actually successfully bring up the antibodies. But this is not what we want, because, as I said, antibodies does not represent the whole immune system of our body. So what is even fascinating is that we have data from Chile, one of the country with a leading vaccination rate. In fact, Chile is one of the country that very successful in their vaccination plan. They are the fastest to cover their citizen with COVID-19 vaccination. So because of that, they are also the fastest country in implementing the COVID-19 booster shot. So this is the real world data. After they have subject their citizen to the booster shot, they actually look into data and see how good it performed. So what happened in Chile is that quite a majority of them received Sinovac vaccine, Pfizer vaccine, and AstraZeneca vaccine. And some portion of them actually receive CanSino vaccine. But there are also a small amount of population actually receive a mixed dose of AstraZeneca and Pfizer vaccine. Okay, due to immune response, some of them they might have allergy to the first dose, or some of them they are on an experimental basis. So there are actually five different groups of vaccination in Chile, and some of them they are unvaccinated. So what happened is that in Chile, they actually subject their Sinovac recipient into different kind of third dose vaccination. Some of them receive AstraZeneca, some of them receive the Pfizer, and some of them receive the same Sinovac vaccine. And this would be the result. And then people will say, CP, this one is so messy, how I'm going to read? It's okay. Everyone actually have to summarize the data, right? In fact, the Malaysian government, after they seen the report from Chile, they actually make it into an infographic for us to understand. All right. So this is the effectiveness in booster dose in preventing COVID. And this data, in fact, is actually presented in a WHO meeting. So it is actually known by a lot of countries about their real world data. Good thing is that the real world data is like is really out there in the field, and whatever is a response from the recipient in their country, it will actually directly reflect to the data. So what happened is that they found that if you have previously 2 doses of Sinovac vaccine and you give a booster shot of Pfizer, which we are doing it currently in Malaysia in the past few weeks, we see that the effectiveness increased from 54% up until 95% in preventing COVID-19. All right, this is 6 months, the effectiveness after 6 months of vaccination, and now they boost up to 95. When they use AstraZeneca vaccine, okay, they boost up to 94. But when they use back a Sinovac vaccine, it only up to 74%. But it's still good enough. At least we can see that there's 20% of increment here, right? It's not like nothing at all. So that would be the current real world result, which I think is very reliable, because this is a government-based study, and this is also from the field. It's not on a testing basis that people will construct research protocol and then they must follow strictly on that. This is what happened in the real world, okay, which is I think is reliable. So after that, they also look into their cases of ICU admission in the Chile. So what happened is that after they roll out the second dose of vaccine, you can see that they actually press down the ICU admission rate. So what happened right now after the rollout of booster dose? Okay, after the rollout of booster dose, we can see that there's also pressing down the ICU admission rate after they implement the booster dose. So in a way, the booster dose also prevent the ICU admission, which is also converting into a clinical important outcomes where they really see that the booster dose is really reducing the hospital admission as well as ICU admission. I did not quote the hospital admission because this graph is actually good enough to show that the booster shot does help, and the weaning off of the antibodies, weaning off the vaccination really needs a booster dose in this case. All right. So next question will be, yeah, we know that it's working, but how safe is the booster dose, right? I'm trying to get some data also, but unfortunately, there's not much of data out there available. But there are some good data that actually can show you all and compare the in terms of the safety profile, whether is it safe for us to use or not. Okay, so this particular studies, this particular research, they actually recruited about 458 individuals to actually see what happens, what kind of side effect they actually experience after they receive different kind of booster dose. So we have a J&J group, Moderna group, and Pfizer group, just like just now what I mentioned. So what happened is that after they're subject to Pfizer booster dose, which we are using in Malaysia, and what kind of side effect they are actually experiencing. All right. So as far as we know, in these 458 individuals, only one case of severe side effect, which leads to a very severe vomiting and need a medical attention, need to be admitted into hospital. There's only one case, no case of mortality, no case of death. And most of the side effect they experience is very common as we previously experienced: injection site pain, tiredness after the vaccination, muscle pain, and headache. These four are the most commonly reported side effects. And the frequency of it is actually lesser compared to those who received the third dose after 21 days in the previously mentioned studies. Okay, probably it's because of the 6-month gap really let the body chill down a bit, and then they reactivate the immune system. So the response, it wasn't that very severe, right? And looking into the detail, as we can see, if for those who receive Pfizer vaccine and get a Pfizer booster dose, their severity or their intenseness of the side effect is actually lesser compared to those who receive Johnson & Johnson and then Pfizer. Okay, this dark color bar is actually representing the number of cases who experience severe more intense side effect, right? So that you can see that receiving Pfizer, although they have a more moderate side effect compared to others, but overall the number of cases of the side effect, right, is similar across different groups. Okay, although it's more in terms of the moderate, but it does not have the severe side effect in the Pfizer group. So receiving Pfizer is considered okay, but if you are using other kind of vaccine like AstraZeneca or Sinovac before this, and you receive Pfizer or you receive back your own vaccination, we are probably expecting a similar response as well. All right. Perhaps there will be more intense side effect with those mixing of the vaccine, right? So the last thing that we want to know is that, should I take the booster shot? Okay, currently we having a lot of us has been called for booster shot. Then we will be wondering, should I get it? So here is my take. All right. After seeing through all the previous records as well as what we have right now and what we are knowing right now, I would say if you are an elderly, all right, above 60 years and above, okay, you are at a higher risk of suffering from severe COVID infection. That is a known facts since the day one of COVID-19, right? And right now we know that if you are an elderly, your immune system drop faster. Okay, that's the second point, which means that you are less likely to be protected from COVID-19. And the third thing that good to know is that elderly, they are also the group that suffer from lesser side effect after the vaccination. Okay, in my family, me myself, I have received the booster dose as well as my mother. So my mother, she's 70-year-old this year. So what happened is that after she received the vaccination, basically she don't feel any difficulties in her daily life. Only some the injection site pain and some arm soreness. Other than that, she don't feel tired, nothing. But me, after I received the booster dose, I felt very tired for 2 days, right? And my underarm, my armpit is actually a bit painful. My lymph node is a bit swollen, and that's it. All right. So if you're an elderly, probably you should not be so worried about the side effect. And as in fact, you are actually the group that should receive it. That's why the government is pushing it for 60-year-old and above to receive. Okay. Secondly, if you have comorbidities, okay, you are having a higher risk of severe COVID as well. But the waning of immunity is also at a higher rate, but to a lesser extent compared to elderly. So if you have a chance, and especially if you are working outside, and if you are coming in contact with a lot of people for your job nature, I will also strongly recommend you to get a COVID-19 booster shot. All right. But if you have any concern that you felt that you want to discuss with a doctor first before you get the booster shot under this group, I would encourage you to do so. All right. But in the general term, I would say that you are still encouraged to get it due to the consequences of getting the COVID-19. All right. Higher risk of hospitalization and mortality, death, because you have comorbidities. Lastly, if you are a frontliner or if you are younger adults like me, all right, this is also applicable to younger adults like me. Okay, what we need to do is that we have to self-evaluate our own risk. Okay, especially occupationally. Okay, if your occupation requires you to actually see a lot of people like me, I'm working in clinic also. So the risk of me getting COVID is higher compared to other people. So then, of course, in the younger population, we know that the risk of a side effect is also higher, including the very rare one, like blood clot or maybe heart inflammation, is higher compared to elderlies. Okay, and those who are 40-year-old, okay, the cutoff line is actually 40-year-old. So we also at a higher risk. So now we have to evaluate the chances of we getting a COVID-19 infection compared to the chances of we getting the side effects. So actually a lot of evaluation have been done, and of course the risk of getting COVID, if let's say we are unvaccinated, is way higher compared to those the risk that we are getting the rare side effect. So a lot of frontliners also, they decided to go with COVID-19 vaccination booster shot, right? And so here I am after receiving booster shot, and I'm talking about the booster shot effect. So then the next concern would be, I do not wish to get a mixed vaccine. All right. If I'm getting the Pfizer line, then I want to continue with Pfizer. If I get the AstraZeneca, I want to continue with AstraZeneca. And same goes to Sinovac. So just recently, I think it's last week, right? This was it last week? Sorry, I think it's early this week, actually. Early this week. We have already received the decision from the government, the meeting on the implementation of booster shot. Okay, so they have actually approved. The Sinovac as well as AstraZeneca vaccine to be part of the booster shot schedule. So in the future, when you call for booster shot, you'll be probably receiving the same vaccine as well. Right? If you are not keen for getting a Pfizer as booster shot. All right. I think that actually sums up with what the current situation would be. And I believe there will be a lot of questions that you would want to ask or clarify. So I think I open the floor for question and answer. Yeah.
Amen. Thank you, Lord. Thank you, GP, for the wonderful talk. I think all of us have been blessed. A lot of factual things and a lot of good advice and wise tips for us. As you know, Dr. Chong, CP, is a registered pharmacist with solid experience in hospital and clinical settings, and has been trained in various disciplines with special interest in infectious disease and intensive care service. So there are a few questions now on the chat group, on the chat box. Yeah, maybe CP, you can answer those. And then while you have any other questions, you can either type them onto the chat box, or you can just unmute yourself and ask directly.
Yes.
Okay.
All right. Let me address the first question, because I think in my slide I did not include it. Booster shot, is it safe to take lesser than 6 months of a second dose? All right. Actually, yes. Depending on what is your first vaccine. The duration of the time frame of the booster shot, it was determined by how fast the antibodies drop. All right. That is actually true. One of the slides actually quoted a few studies. So for Pfizer vaccine, they agree that to actually have they actually agree that the booster shot should be given at a 6-month duration. Whereas they actually found that the Sinovac vaccine, the antibodies drop faster compared to those in other vaccination groups. So they decided to actually start the booster shot right after 3 months to 6-month period. That would be the period best for Sinovac booster shot. So actually in this document itself, sorry, I unshared the slide. Just a very quick one. All right. It actually says that AstraZeneca to be actually implement 6 months after the second dose. There's actually a page 2, but I did not put it here. The page 2 actually says that for Sinovac vaccine is actually between 3 to 6 months. All right. So that would be the period they found that where the antibodies drop a lot, and that would be the best time for them to start. So in fact, if you have previously received Sinovac vaccine, then by now you should be called for the booster shot already. Like my mom actually received the booster shot faster than me, although I received the first dose first compared to my mom. My mom received the vaccination way after, but she received the booster shot. Yeah. Okay, so yep, it depends on what kind of booster, right? What kind of first vaccine. Okay, Paul asks, Sinovac is apparently getting a better review based on the data from China, where they have a large population and experience in dealing with such viruses or things. Why then is this vaccine appear underperformed in other parts of the world? This question, all right. My opinion on that is that yes, this vaccine is from China, and of course China will be publishing a lot of data. In fact, if we look into the antibodies waning effect, how fast the decrease of the immune system after the Sinovac, the studies from China actually agree that it should be 6 months, just like Pfizer, right? But of course, depending on different countries and different data, they quoted a different duration as well. And I believe that the Chile studies is considered as quite in the middle ground. We know that it's actually a fight. Okay, it's a fight between the US side as well as the China side about the vaccine, right? Because both of them, they actually are the countries, the mega countries that actually produce the vaccine. But I believe the study from Chile is quite reliable because Chile, most of the vaccination they use is actually from Sinovac. That's why they can actually cover their citizen very fast. And the data that shows that I believe is quite in the middle ground, is quite honest about what is happening. And I believe the data is true. Yeah. Okay, so after that, I have a question from
Yep.
am I receiving a question? Yeah. Okay, from Angadi. How do I know you are eligible to receive booster shot? Please check your MySejahtera application maybe once a week at least, or maybe twice a week. Because right now they will actually automatically enroll you into the vaccination program. Like my mom, actually the hospital that provide the vaccine actually called me 2 days before, okay, for my mom's booster shot, because my mom never actually answer whether never confirmed the appointment. And I also did not notice that. So the hospital actually called me to confirm whether my mom will be actually going for the booster shot. So then only I check her phone. Oh yeah, there's actually notification. So I would advise for those who interested to receive the booster shot, you may actually check your MySejahtera app, especially if you know that if you receive Pfizer vaccine before this and it's already after 6 months, or you receive your Sinovac vaccine is actually already after 3 months. Okay, for AstraZeneca it would be 6 months . but AstraZeneca, you know, we have a very long gap in between first dose and second dose. I think it will be some time before you really being called for booster shot. All right. So keep checking your MySejahtera app, like maybe once or twice a week, just to know that whether you receive the notification for the booster shot or not. All right. Next question. From CK, is the mixed vaccination approved by WHO? As far as I know, China government never allows its Sinovac to be mixed with other vaccine, and the booster of Sinovac is only allowed after 6 months in China. Okay, to answer CK's question, the mixings of the approval actually varies from country to country. Like just in Malaysia, okay, right now each of the country their own health department is actually working on determining their own country situation and whether should they actually go for a booster shot or mixing vaccine. For CK's curiosity, I mean, in China, we know that everyone is using their own brand of the China's own vaccine, whether it's CanSino or maybe Sinovac, right? So they don't really take in vaccine from other countries. So of course they are not mixing it. That would be the first point. But for we other countries like Malaysia, Chile, Indonesia, Singapore, and etc., our supply of vaccination is a bit limited. Okay, whether from AstraZeneca, from Pfizer, from J&J, or maybe from China, CanSino or Sinovac, it is limited. So we have to make use of our own resources, whatever is available. So based on the stock that we are available right now in country, then we will decide on the strategy that we want to move forward based on all the data presented. Yeah. So whether mixed vaccination is approved by WHO is a bit of gray area. They never like publicly make an announcement or say that, oh, we support or we don't support. Yeah, WHO have to be very careful. So yep, that would be the current situation. Some even, I mean, I have heard some senior consultant even says that one of the reason that they use Pfizer in the beginning is because we have more stock of Pfizer vaccine compared to other vaccines. So they use a Pfizer as booster first. But I'm not so sure how true is that. Yeah, because it's from a senior consultant who involved in all these vaccination program. Hope that answer you, CK. Yeah.
Yeah, Dr. Chong, Jimmy here.
Yeah. Hi.
Okay, my wife and myself actually have the booster shot. And I'm not beginning to understand why they don't have to wait until, because earlier 2 doses from Sinovac. I think I didn't understand why they don't wait until 6 months.
Yeah.
In fact, after 4 months, we were informed by MySejahtera. And that goes to my mother-in-law who's 84 years old, 88 years old. My wife just corrected me, 88 years. And it took Pfizer as a booster shot. Until today, we are, I mean, praise the Lord, we are fine. The only side effect is what you mentioned in general about the
no armpit at all.
Armpit, that's a basic thing.
Oh, if no armpit at all, I really admire you all.
Okay,
I myself, I was not off for 2 days actually. Yeah.
So when I received my booster jab, I did ask the doctor, what's next?
Yeah, what's next, right?
Will it be another booster, and how effective is this booster shot? And are we getting another booster shot? So this is the question. Maybe you can address this.
Okay. Yeah, I'm more than happy to answer this question. In fact, this question, it was asked in the previous talk. Yeah. So are we getting infinite answer of booster shot in the future? Judging from the current situation, I believe it's yes. Okay. Based on experience, I'm just taking a few different kind of vaccination that we commonly having. Hepatitis B, the booster shot is meant to be in place from time to time. What happens is that we need to check the antibodies in our body, and then we need to get booster shot when the antibodies is down. Okay, that is for hepatitis booster shot. Some they have to take it after 2 years. Some take it 3 years, but averagely they say it's 5 years right? You should get the booster shot. Influenza, okay, influenza vaccine is every year. The booster shot is every year. So I'm not so sure how long we are going to keep up with this vaccination for COVID-19. Will it be every 6 monthly that we need to get a booster shot, or can we really prolong it in the future, or when the COVID-19 cases is really getting eliminated and eradicating from the surface, and we actually consolidate the cases in a certain specific place and then getting lower and lower, perhaps the duration in between can be prolonged as well. So right now it's uncertain, because whatever we are doing right now, we are learning it from the real world data. Okay, we receive data, we try to do some intervention and do some policy. After we implement, we receive data again, we analyze what would be the outcome and what would be the best course action. So yes, we are not sure what will be the future and how long we are going to on a booster shot in the future. That would be my answer lah.
Okay. Thank you.
Amen. Praise God. Any other questions for CB? Okay, there's another question from Paul.
All right. Chat. There's corridor. Wait. Okay, there's that booster being offered, promoted here, and they are based on expiry date, meaning that we are clearing those expiry. In my opinion, I don't think so. It's true lah. If let's say that is true, right, we don't even consider to bring in AstraZeneca and Sinovac vaccine as booster dose. Yeah, but back then, yes, there was once upon a time that in US actually they bought a lot of Pfizer, and they have a lot of extra doses. So they even consider to actually inject animals with Pfizer vaccine. Okay, I mean, although it sounds a bit funny, yeah, I know, but it is already known that humans are not the only host of COVID-19 vaccine, COVID-19 virus. Other animals, other mammals, they also can actually be infected with COVID-19. Okay, they also can be spreading it. But to until what extent and how invasive and how aggressive is the spreading from animals to humans or animals to animals, we are not so sure, because it's very, like Kelompok cases, like a cluster case like that, it's very hard to determine and come up with a conclusion. So yeah, so I think during that time, US also donated a lot of vaccine to other countries because they stock up a lot, and I would say it's not really expired, because when you check your vaccination certificate, there's an expiry date, right? The expiry date is just the bottle itself. If you don't use it, what will happen to that bottle? After that date, they have to discard it because it's no longer useful. But once it's in your body starts to act up, the expiry date is no longer applicable, I would say. Yeah. So do not worry about the expiry date. As long as you go in, it will be utilized by your body, right?
Okay, my last question. I just wondering, why? Because there are just too much information flowing all over the place.
Yeah.
Right. And then I'm glad that New Life Restoration, to you, Doctor, that at least you can share your thoughts. I mean, your experiences and data sharing. At least it gave us some confidence. I mean, not just as Christian, but as any human soul, right? And so at least they can decide there and then what choice they have to make. And of course, depending on how strong is the immune system. So in what way we as Christians should address this issue? You know what I mean? Especially among our family members, right? So as not to create unnecessary fear, right? And then by not telling what it is, in a sense that, we are also doing a very injustice. Because that person might deprive himself or herself from I'm not saying the vaccine is the answer to everything. But
yeah,
at least
true.
It's a means, right, to keep us going, but at the end of the day, it's the Lord. So I just wondering in what role can we play from as a church, like as a Christian, maybe Pastor can answer.
Yeah, I think I will direct the question to Pastor also. Yeah.
Because very tiring to hear too many of those, and these people don't know the background. With due respect to those who share, right? They just forward here, forward there. I've been receiving many until I have to call the person to explain to him to whatever I know to reassure him, right? As much as I can with the data.
All right. I would like to invite Pastor to actually give his perspective on the church point of view. But I might personally, can share a bit of my personal opinion on sharing information. But Pastor?
Yeah, I think, yeah. Thanks for bringing up, Jimmy. I think there's been a lot of misinformation floating around in social media. In fact, WHO has said that there's also an infodemic, a lot of misinformation, which causes a lot of people to be confused. They don't know what is right and what is wrong, and they're unable to get proper guidance because of so much misinformation that's in social media. So it's good that once in a while we have talks from a real expert, like Dr. Chong, who not only gives us the facts but also backs it up with statistics and a lot of logical reasoning. And I'm glad that CP not only gives his personal opinion but also is not biased to any. If it's not there, he says it's not there. So yeah, I think we should be having more of such talks to really clear out a lot of doubts, to give direction and purpose to our church, because it really affects our health. Yeah. Any other comments from anybody here? I think
maybe I can. Yeah. But before this, maybe I can give a bit of point of view on sharing information. I would say whatever information we receive from WhatsApp or anything, if you want to share some information, I think it's okay. But how do we evaluate whether to share or not to share? Okay. We encourage, if you want to share information, it is all right, but please share the information from reliable sources. I would think that the infographics or maybe statistics from government or statement from government is good to share, right? Especially like I remember when the government announced that they will actually consider Sinovac and AstraZeneca to be booster dose. That one, if you want to share things like that, I think it's okay. But if you are not able to tell where is the source of the information and how reliable is the source of information. For example, it just says that Abing's auntie says that this, or maybe Alien's uncle says that, that kind of information, please don't go forward. Okay, let's put a stop, rethink whether is it good to share this information or not. All right, I would believe that everyone is having their own opinion on this COVID pandemic. Some they believe that vaccination is the way forward. Some believe that as long as they keep themselves safe from the crowd, they will be safe. So they don't plan to get vaccine also. I have friends like that, all right? Which I try to talk to them. They are healthcare professionals also, but decided not to take. So I can't do anything also. There are two different school of thoughts, and some things that should go for booster or not. I think decision is your personal decision. Whether to influence others to follow your decision, you have to think very carefully. All right. When you give a recommendation to them, means that you are hold accountable to whatever you say. All right. Just like today, I'm here. Whatever I say here today, if anything goes wrong, I have to hold accountable for that. So that is why we have to be very careful when you share the information. If anything happens to that person, are you going to be responsible? That would be my question lah. Yeah. So I know Sharon, you want to ask some question just now, right? No, not yet.
Yes. Dr. Chong, Sharon here. I've had my second shot on the 9th of June. And until today, I have not been called for the booster shot. So I just want to ask you, doctor, do I just wait for them to call me?
May I know that what is your Pfizer? All right. Pfizer will have to wait for 6 months. So if it's 6th of June, then will be December.
9th of June.
9th of June, then will be 9th of December, around that time.
Okay, so I just wait. There's nothing to be done.
Yeah, for now, it's nothing to be
I
done.
just wait. Nothing
Yeah,
to
you
do.
just wait first. And
Okay.
I think the government
Okay.
also coming out with a policy on signing up walk-in booster dose for those booster shot center. So I think if until that time, if you have not received a call, maybe you can sign up for a walk-in.
Okay. Okay.
Yeah.
Thank you.
But don't worry, you are not time yet. Okay.
Okay.
December. Right. I know everyone kanchong a bit. No, it's okay. It's okay.
Yes,
December,
because of my age and all that. Yeah, kanchong a bit. You're right. Thank you for clarifying today. It's very comforting to know the facts from a doctor. Thank you so much.
Dr. CP, I have a question. Diane here.
Hi.
Yeah. Okay, I don't have a reliable source. My source is from the media, Telegraph. It says that AstraZeneca creators, the scientist says that the AstraZeneca vaccine can last forever. No need booster. Is that true? That's why I'm asking, because it's not a reliable source. It's from the media.
It's not true. It's myth.
Okay.
Straightforward.
Okay, so that's why you mentioned just now, even AstraZeneca recipients also will get booster, right?
Yes. In fact, in I think my second slide or third slide, I actually quoted one of the studies says that the AstraZeneca, the immune system also went off after 6 months. Yeah.
Oh.
Yeah,
okay.
that's why when you ask me, I can straight away say that it's not true.
Okay, so thank you for that. Then okay, let's say we were to check our antibody. What is the waning? What do you mean by waning? When the antibody level is what? Up to what?
Waning, as in antibody level is decreasing in trend, start to drop.
Oh, so what is the measurement?
As in the measurement, as in the level, is it?
Level, yeah.
That one, if you really want to know, there are some lab that actually offer to do that, okay, to actually have help you to measure the antibodies level. But I would say that how reliable is the report to convert it into practice or convert it into like an action? I think it is still very weak. In fact, my university myself, the university that I teach, IMU, we have our own lab, and we do offer some of the staff as a discount rate to do the antibody testing. But I talked to my doctors in the clinic also. We think that yes, you can check, but as I say, immune system is very complex. It is not about the antibody alone. We have to look into other component of the immune system as well, right?
Oh, okay. The reason why I asked is because my friend went for antibody test and she said that it's very good. The doctor said very good. So cannot base on that to decide no need to take the boost.
No, I don't think so. Yeah, I don't think so. It's just telling you that when you see there's an increasing in antibodies, it means that the vaccine is working in your body. The only thing that we can know is that, yeah.
Okay, thank you very much, Dr. Chong. Okay, bye.
So to summarize Diane's question, and my answer is that we should not rely on the antibody level to decide, on the antibody level to decide whether should we go for booster shot or not to, or what would be the next course of action. It's just if after your vaccination, if you see that your antibody level increase, it means that the vaccine is just working, right? But how good it works or how bad it works, we cannot tell, right?
Praise the Lord. There are a few more questions, CP, on the chat group. Yeah. From Nancy and CK.
Okay. Will there be any complications or conflict of Pfizer and Sinovac vaccine they are fighting against? Okay. Let me answer Nancy's question first. Can we share a bit on the oral pills? All right. Recently, there are a few things that come into a picture. Okay. Now it's vaccine and then booster shot. We also know that there are some oral pills coming in. All right. Particularly for the treatment of COVID-19. Here is the two different things actually. Vaccination is for the prevention of a disease. Okay. Whereas oral medication like oral pills is actually meant for the treatment of the disease. So if you never get the disease, you do need to treat. All right. I think this is very true about the ivermectin issue also, right? If you are not sick, then the ivermectin things, right, it actually is nothing to do with you, right? I think I'm still waiting for the report from Minister of Health. The results, you see, don't get it yet. So now the issue also died off already. But I would say that prevention and treatment is two different things. Okay, prevention and treatment is two different things. And the oral pill to treat the COVID, we are still yet to have a lot of data on that. Okay, that's based on the it is based on the research data. I mean the trial data from the Pfizer company. So after they release it, then we will have a look, and then when it is on the ground, like in the field already, we will see the response. Then we can tell more story about that. Yeah, it's always, as I mentioned just now, we have something new. We see first, we test first, and we get the data and see how good it performs. Right now, the COVID situation is a bit like that. Yeah. Okay, so next up, will there be any conflict for Pfizer and Sinovac vaccine when they are fighting against COVID-19 at the same time? They are using two different methods to fight COVID. No, it's okay actually. It just okay. The basic concept is that both of these vaccines, it trigger our immune system to produce antibody. Okay, and it train our immune system to recognize COVID-19 virus, and so that our body can fight against it more effectively. Although they are using different ways to trigger the immune system, but at the end of the day, it's still the same immune system. So there's no issue if we are mixing it. Yeah, just using different method lah. Okay, so let's answer Dr. Wei's question. My friend got booster shot, mixed Sinovac Pfizer. After 2 days, the booster shot, she collapsed. Any comment on it? All right. I think it's hard for me to comment just like reading a statement like this. I need to know that for what reason she collapsed, right? And what would be the investigation be like? So I do also receive, oh yeah, there's one case that I want to say. When I was receiving my booster shot, I'm receiving Pfizer. So I talked to the doctors that actually administer the vaccine to me. And she actually asked me, does anyone drive you here or you are driving on your own? So then I asked her, why are you concerned about that? Because it's uncommon for people to ask those who receive the vaccine. So she told me that, previously she had an individual who received the booster shot. She was so dizzy, okay, and she actually fainted. All right, but we know that dizziness is actually a side effect of the vaccine itself. Okay, that is a known fact. But what happened is that when she fell down, she actually knocked her head. So that she actually got admitted into ICU. Hopefully it's not the same person that we are talking about, right? Maybe it's different person. But what happened is that it actually is the dizziness causing the collapse, and that actually makes the sick individual into hospital. So I will not say that the vaccine itself causing any issue to the brain, but it's because of the intensity of the side effect, and unfortunately you fall down and fall on something, and then knock her head, and then that caused her into hospital. So the message I want to say is that unless I know the whole story and the whole investigation, what is happening, I'm not able to give any comments. Sometimes one tiny little side effect can lead to consequences later on. Just like our blood pressure, high blood pressure medications. Some of you might have 2 medications, some of you might have 3 high blood pressure medications if your blood pressure is not controlled. The issue is that you control your blood pressure, but sometimes because you control it like until too low, you get dizzy. It's common to have dizziness. But what happens is that if you accidentally trip on something and knock your head? So do we say that the blood pressure medication cause you to go into hospital, but it's actually causing the dizziness? So it's not like a direct effect. So yeah, that would be the case for this. Okay. Let's go to the next question. All right. Hopefully, I answer your doubts lah for Dr. Ooi. It's very limited things I can comment. Yeah. Question from Lillian: is it advisable for students above 18-year-old to go back to uni college to take this? Is it advisable for students above 18 going back to uni to take this booster shot now? Right now, for this age group, we are not giving the booster shot yet. I think they are still yet to receive their booster shot for those young adults. But for those who wonder whether they should go back to school or not, because school now is reopened, but the parents, they can actually write in for not letting their kids to go back. All right. So I think it's a very personal decision whether you want your kids to go back or not, and whether your kids want to go back or not. All right. It's kind of on a personal decision. Although we believe that with the vaccination in place, they should be safe to go back to school, but they still need to practice all the usual hygiene, like wearing mask. Okay, don't be a Karen. Okay, wearing mask is very important. Okay, always wash your hand and maintain social distance. Okay, especially in school where we have a lot of individuals in the classroom and etc. Even with the vaccination, still need to practice all those things lah. And I still can observe a lot of people, they do not wear their mask correctly lah, up until today. That would be one of the reasons why we always keep on having cluster cases of COVID right now, despite the vaccination, right? Because we are not putting strong enough effort on that. So in conclusion, I think it's a personal decision. Yeah. I'm not against it. I will not against it lah. Yeah. To go back to school. Hi, next question. Hi, I'm Steven. Is that true that those the Pfizer cause toxin in the body that based on some media shared around? Okay, let me rephrase the question. Does the Pfizer vaccine create toxin or in our body? So the answer is no. Actually, it is not. As we know, the Pfizer vaccine, it actually contains the mRNA. Okay, mRNA. mRNA is like a script. It's like a recipe on creating different kinds of things in our body. Right? Without the vaccine itself, our body do have mRNA. We are producing mRNA in our body on a daily basis. All right? Those enzymes that we produce in our body, our cell function, whether you have a scar and you have a wound and then you're having scar, actually everything's that all the processes, right, involve mRNA, but it's meant to produce different things. All right, that's key things. So what happened right now is that when we give Pfizer vaccine, we are giving them an instruction using mRNA. We are telling the bodies that, hey, come and create this antibody. All right, antibody is a kind of sort of like a protein also in our body, where we also use mRNA in our body to produce different things. So does it leave a trace? I would say no. In fact, after 2 weeks of your vaccination, most of the mRNA that you injected will be gone. All right, used up by the body and break down and produce the antibody. So it leaves nothing inside our body actually, except the trained soldier, which is from our own body, that produce the antibodies lah. Yeah. So it's not true.
Praise the Lord. Yeah, I think you've answered all the questions, CP. Thank you very much. You have done very well. As I said, it is one of the most informative sessions I have heard on COVID-19. So let's everyone unmute ourselves and give CP a big thank you. And yeah, and maybe you can clap your hands as well. Thank you, CP.
Thank you,
Yeah.
Doctor. Thank you very much, Dr. Chong. Thank you.
Thank you so much. Praise the Lord.
So
Thank you.
Yep.
Yeah, I think with this talk, we can all live longer.
We just hope the COVID get away lah. Yeah.
Yeah. Praise Okay, God bless you all. Thanks for joining.
Thank you.
Thank you.
Have a great
Bye.
day.
Right. Please stay
God bless
safe,
you.
please stay safe. Especially recently, we can see cases are increasing again. So please really stay safe. Right.
Amen. Amen. God bless you.
God bless. Thank you.
Thank you.